Now, getting back to the interpreting process and accepting mental health assignments, an interpreter needs to be very aware of what their role entails in the mental health setting. An interpreter needs to know before accepting a job if they are going to be capable of understanding different mental health evaluations and different therapy options that will occur during the process of the mental health in the mental health setting. Now, this can be a challenge, but sometimes what happens is the mental health hospital will give the interpreter a heads up. They will let them know what type of patient that they are working with. Perhaps they have a 15-year-old girl who is contemplating suicide. They will let the interpreter know, and then it is up to the interpreter to decide what to do with that information. The interpreter first needs to decide if they are comfortable accepting that assignment, if they're comfortable working with that person specifically. And then after deciding whether or not to accept the assignment, the interpreter needs to then do their research. The interpreter could use Google and research different terms that could pop up, different evaluations that could occur, and different things that the doctor could say in the assignment. And then that way, when they go into the assignment, the interpreter will know, they will have this background knowledge and information to pull from. This will help immensely because it will limit how often the interpreter interrupts the psychologist. And oftentimes, deaf patients get very upset and very annoyed with the fact that the interpreters constantly have to interrupt the psychologist because they're not understanding and they need clarification. Now, it is okay for interpreters to turn down mental health assignments. Even qualified mental health interpreters will turn down assignments. Perhaps an interpreter is specifically not comfortable working with somebody that has schizophrenia. Maybe there are other interpreters more qualified for that job, so they don't hesitate to turn down those type of mental health assignments. And it's important for interpreters to realize and know what their comfortable level is working with specific patients, and then that way they can decide whether or not they will hinder the process or if they will help in that process. Moving on to the next topic that is tough in the mental health setting for interpreters is medicine. There are so many different types of medicines, and for interpreters, I really think that it is helpful to use Google, again, to research the different types of medicines. What does it look like? What color it is, how it is administered. Once the interpreter has this information, and once they research it, it's easy. Then when they're in the setting and they need that, they have that information. They can tell the consumer what color the medicine is, or, oh, that circle pill you have, that's the one that you need to take. So it's very helpful to be able to expand on the medicines to help the deaf patient. Because oftentimes what happens is the deaf patient will not understand. If the interpreter just finger spells the name of the medicine, they don't understand, and oftentimes it can lead to taking the wrong medications. Moving on to the next tough area in the mental health setting for interpreters is when patients are on a 72-hour hold. And oftentimes, the patient themselves doesn't understand, but what happens is the state actually is forcing the patient to stay in the mental health hospital for 72 hours. And once that 72 hours is over, they do have an option. They can petition the court because they want to leave. That is one of their options. And the second option would mean that the patient would volunteer to stay for treatment. Now that process is very challenging for the interpreter and for the deaf patient. Because oftentimes that sign volunteer, the intent of that sign is positive, meaning, oh yeah, the person wants to stay. But that's not what it is in this case. It's not positive, and often that's how it's interpreted. So it's difficult for the patient and for the interpreter. The interpreter needs to have the background information and the knowledge and the signs to be able to give all of the background information and all the possible options to the deaf patient for them to make the best decision based on whether or not they will voluntarily stay or if they will involuntarily stay. And again, going back to that sign volunteer, it means that they have a choice. And oftentimes in the mental health setting, there really isn't a choice. It's a very serious situation, and the doctor is recommending that they stay. And if they don't stay, there are huge ramifications that can happen. So again, it's important for that interpreter to expand and let them know what volunteering actually means and what it all entails. Now, we've discussed all these different ways how the mental health setting can be really tough. And here's another one. Interpreters will often see patients in restraints. They will see them locked up, and they see people at the worst point of their life. Sometimes you may see or work for deaf consumers out in the community, and you might work for them on a regular basis. But then if you see them in the mental health setting, wow, it's really different. And it's really tough to see that person in that situation. And it's important as an interpreter to have that compassion and to leave the person with their dignity. And it's important as an interpreter to not make judgment, to have compassion, to leave that person with their dignity in the mental health setting. Because then that way, if you see them back out in the community, in the general environment, and you work for them in a different setting, that if you had compassion for them in that mental health setting, then you develop a trust, and the person will not feel awkward around you in a different setting. And if you make judgment on them, they will not want to work with you out in the community again. So it's important as an interpreter to have compassion always, and to always leave the patient with their dignity in the mental health setting. Now, it's not uncommon for an interpreter to work for somebody in the community, and this person could be a strong leader in the deaf community. And then that person could experience some type of trauma, and this trauma then leads to them being in the mental health setting and having to go in. So it's important to remember that you could see them in both aspects of their life. And to know that when you're talking with this person in the mental health setting, that they are going to be communicating on a different level. Perhaps their language is deficient because of the trauma that they've experienced. Now let's use Marika as an example. She is a teacher here. She is absolutely brilliant. Now imagine seeing her in a mental health setting. You would not use the same terms, the same vocabulary, and speak to her on the same level that you would if you saw her here at UWM. And that is specifically because after experiencing trauma, that trauma then is going to lead to her having deficient language. And you need to be aware of that and adjust to that and meet the needs of that client in those different situations and in the mental health setting at all times.